I'm Dr. Leigh Erin Connealy, the Medical Director for Cancer Center for Healing and Center for New Medicine. Today we're going to talk about pancreatic cancer. Like most cancers, cancers are detected very late in their disease. And the pancreas sits here, right behind the stomach, right in the middle of your abdomen. And unfortunately, there are no signs and symptoms of pancreatic cancer until it has fully progressed into a disease. And I tell every patient, from one cancer cell to tumor formation is about 10 years. So our focus here is early detection and prevention. And unfortunately, we all think that everything's all good and wonderful and nothing's wrong and our blood tests look good and we don't look for cancer. And the way we focus here is we're trying to prevent an early detection. But unfortunately, in the medical profession, we're diagnosing cancer at year 10. And so if that happens, though, we want to know all the possibilities of pancreatic cancer treatment. As I said, that pancreatic cancer is the fourth leading cause of cancer death. And I think the biggest reason is that we're diagnosing it very late. Now, also, the pancreas sits here in the middle of your abdomen behind your stomach. And oftentimes, you won't have any symptoms of the disease, and you will find it in a progressed state. So there are pancreatic cancers. There's the neuroendocrine type and then the pancreatic cancer type. And so your pancreas sits, like I said, in your abdomen, and it's kind of like a T-shaped organ. And pancreas makes insulin, glucagon, and pancreatic enzymes. So we want to know what really contributes to pancreatic cancer. Pancreatic cancer, if you smoke, you're higher risk. If you're diabetic, if you're overweight, if you're exposed to toxicity, if you have a family history, and these are the contributing causes of pancreatic cancer. Now, all cancers have different stages. You have stage 1. So stage 1, it's just localized in the area. Stage 2, it has spread out of its original area. Stage 3, it's gone into some of the surrounding blood vessels and lymph glands. And then stage 4 has traveled to other organs like the liver or the colon or the lungs. And so it is better if we can diagnose pancreatic cancer early. So what are the symptoms of pancreatic cancer? Well, I would think that one of the biggest symptoms is you're losing weight rapidly and you're not trying to lose weight. Then fatigue, abdominal pain, here or possibly radiating to the back, blood clots turning yellow, and just you don't feel good mentally, you're depressed, you just are not feeling well in general. So these are signs and symptoms of pancreatic cancer. As I said earlier, early detection and prevention is best. Now, how do they even make the diagnosis of pancreatic cancer? Well, you can do an abdominal ultrasound first. I think that's a simple, easy way. So what is an abdominal ultrasound? Looks at your liver, your gallbladder, your pancreas, and your kidneys. So it does a good evaluation of the organs in your abdominal system. Now, if they see something abnormal in ultrasound, they can order an MRI. An MRI will delineate more definitively masses anywhere in the abdomen, so that's good. And then sometimes they do an endoscopy looking at the pancreas, and that will give us a very clear picture of the pancreas. Obviously, we use PET scans. PET scans are full body imaging. Cancer cells most of the time will light up because we give radioactive sugar and cancer cells love sugar, so they will light up on the PET scan. So we will do a workup that will determine what the extent of the disease. Now, I do extensive blood testing. When I say extensive, we do chemistry, CBC, we look at the hemoglobin A1C, because the hemoglobin A1C is a reflection of your sugar over 90 days. It's also an aging, and as I said earlier, diabetes is a risk factor for pancreatic cancer. Then we look at C-reactive protein, vitamin D, we look at nagalase, we look at PHI, we look at a very extensive array of blood work with the patient. Now, the marker for pancreatic cancer is CA19-9. Now, typically doctors are not doing tumor markers on patients, but because tumor markers aren't always related to the cancer, unfortunately, but we can do CA19-9 and CEA. The key thing is, if you have persistent symptoms, a doctor should be able to figure out in about 4 weeks what is causing these problems. So always don't take no for an answer. Keep looking until the doctor finds out what your problem is. Now, let's talk about what are the possible treatments. The possible treatments, first of all, you may need surgery. You may need surgery to remove the tumor. And so I always tell patients, tumors are immunosuppressive to the body. So you've got to remove the cancer. So there's a procedure called the Whipple procedure. So there are patients that may need that. Now, if the pancreatic tumor is just in the pancreas, a lot of times that procedure will suffice. Now, if the pancreatic tumor has grown to other parts of the body, you will have to do conventional chemotherapy. At the clinic, we do low-dose chemotherapy. We're using 10%. We use the RGCC blood test. The RGCC blood test is a blood test that's done in Switzerland and Greece. And what they do is they give a panoramic view of circulating tumor cells, the specific chemo agents, the specific natural agents, and also any kind of smart drugs that may work on the cancer. So we are able to look at all the possibilities of fixing you, looking at targeted treatments that are assessed on the RGCC blood work. So we want to know all the things. I always tell patients, there isn't anybody's cancer that's the same. So the more information that we possibly know about what will work on the cancer, the better. So our treatments may utilize conventional chemo, may utilize low-dose chemo. Obviously, we have all the patients see the nutritionist, because we know that what you eat can affect how we heal. So I tell people the single greatest determinant of health is what you eat. Now, for our patients with pancreatic cancer, I recommend a ketogenic. So I highly recommend that you look up the ketogenic eating program with pancreatic cancer, because the ketogenic takes away all the carbohydrate intake. So the pancreas doesn't have to overwork to take care of what you're eating in carbohydrates. So the ketogenic is high fat, protein, and very low carbohydrates. So you don't stress out the pancreas. Now, there's a great book called Cancer and Metabolic Disease, Brian Seafried, that writes, so I highly encourage you to watch some of those YouTubes on ketogenic eating and cancer, and how beneficial it is for pancreatic cancer. Now, the other things, there are drugs that starve cancer. So we like to test individually all the different drugs that possibly can starve the cancer. There's a great book called Starving Cancer. So we will decide individually with each patient if those drugs may be beneficial. We also will recommend coffee enemas. Coffee enemas have been around for over 100 years. Those help clean out the liver, and patients tend to feel better, especially if they have severe abdominal pain. Coffee enemas were originally used for pain control, but we now know that it helps clean out the liver. so it can be a beneficial adjunct. We also use pancreatic enzymes. Pancreatic enzymes are made by the pancreas, but if you're ill or sick with pancreatic cancer, you're not producing the pancreatic enzymes. Now, there was a Professor John Beard who also found that using pancreatic enzymes 100 years ago helped the patients get better. So there was a famous dentist who got pancreatic cancer, William Kelly, who used high-dose pancreatic enzymes along with other nutrients for the patient to heal. And he had pancreatic cancer. The other doctor who has a lot of history of using pancreatic enzyme is Dr. Nick Gonzalez, who died about 5 years ago, but his program was instituting the proper eating program that he felt like there was individual eating programs, which is what we do. There is no one size fits all, using pancreatic enzymes and support with proper minerals and nutrients for the patient to heal. So again, every individual is an original, so we design a program that will individually assess every person and then develop a personalized treatment plan. There is no one size fits all. And so if you were to diagnose with pancreatic cancer, I highly encourage you to look at all the possibilities in treatments, because we know that pancreatic cancer is a very deadly cancer, and we want to make sure that the patient has the best quality of life and the best options available in their cancer treatment. As always, thank you for joining me today. If you have any comments or questions or concern, please submit them to us at the bottom, and we'll be more than happy to help you and assist you in your healing journey.